Hi class, my name is Crystal Harris, and I am doing my presentation today on the Idaho Department of Health and Welfare Foster Care Division. The mission of the division is to build a responsive, educated, and stable foster care community of families that can meet a variety of needs, recruit and support safe, nurturing, trauma-enforced resource parents, and these resource parents can include foster, kinship, respite, and adoptive caregivers. The goal of foster care is to provide a temporary arrangement for children and teens when their parents or primary caregivers are going through crisis. When youth cannot remain safely in their homes and must enter foster care, the first goal is to safely reunite them with their families. However, if this is not possible, to find permanent placement as soon as possible. The division is managed by the Region 1 Foster Care Licensing Supervisor. His name is Brandy Sanchez, with her licensing team, Judy, Nicole, and Michelle, and of course their intern, Crystal Harris. The main governing body of this department is the Foster Care Division of Child and Family Services for the Idaho State Department of Health and Welfare, which is run by the Idaho State Legislature. Collaborating programs for this department are the Idaho Department of Child Protective Services, or CPS, and the Idaho Adoptive Services Division. The funding sources come from many government grants and vouchers. Title 4-E funds of the Social Security Act and Title 4-B funds of the Social Security Act. Funds from the Child Abuse Prevention and Treatment Act grants, Social Services Block grants, and of course miscellaneous state and local funding. The foster care licensing process for resource families generally begins with a phone call to the Idaho Department of Welfare stating their interest. At that point, they would fill out an application and a background check. Once that was done, they would attend a 3-hour informational meeting about information and resources and community options for foster care. If they're still interested, they would attend a 4-week Pride class, which would teach them 5 competencies to foster parents: protecting and nurturing the child, meeting their developmental needs and addressing delays, supporting relationships between children and their families, whether birth and or foster families, connecting the child to safe nurturing relationships intended to last a lifetime, and working as a member of a professional team. At that point, they would have their first home visit where they would assess the safety of the home. They have a checklist that they would go through to make sure that the home is appropriate for different age levels of children. And then they would give the foster families more information about fostering in North Idaho and some of the supportive resources that they have to offer. They would take that assessment back and meet the criteria of that first home visit. Then they would receive a second home visit to correct anything that needed to be correct from the first visit, and then to kind of talk about the family structure, such as their cultural beliefs and discipline techniques, just to make sure that they feel that they are appropriately trained for foster care. At that point, they would apply and be approved for the licensure of a foster family and home. However, if they didn't meet some of the guidelines in any part of this process, they may be denied, and the department can withhold approval for the applicant. As an intern, my roles in the department are to observe and assess foster care families via phone, video calls, and in person, prepare assessments, home visit synopsis for the licensing department, research proven strategies and techniques to support foster parents and children in varied situations, and provide support to encourage positive relationships in the home. And of course, work with the team members to assess and identify local, community, and national resources available to nurture, support, and encourage well-being of foster children, as well as the relationships with family and staff that can last a lifetime. So that was only 5 minutes.